Hello guys, I welcome you back to my channel, and if you are following up my all of the videos, so you would be able to comprehend this particular prescription as well, and you would be knowing that what's a difference between dose and dosage, right? Over here it is a clear example that is a dosage. I'm going to plot a graph today in front of you to make you comprehend more of the things. There is a drug called drug A and drug B over here, which I'm going to show with blue and red respective markers, and I'm going to plot a graph between drug response and drug concentration. Drug response of A is shown over here via blue marker, as you can see it, while B is showing more of its effect as compared to drug A. Now this is actually called efficacy. What is efficacy? The effectiveness of a drug to show the effect which we want in the maximum way, irrespective of dose. While the difference between the dosages and the required amount of dose which we need to have the required effect, therapeutic effect, is called as potency. From the prescription over here, I can make you understand again the similar prescription of paracetamol 500 mg TID 3 days. Over here 500 mg is actually indicating its potency. This much dose is required for the potent effect, while taking it twice a day for 3 days would actually show its effectiveness, because every time we focus on two major effects. Major effect which we want always is the therapeutic effect, which is from the root word therapy, while toxic effects are the undesirable effects which we obviously don't want, which we can actually call them in a layman language as side effects. These effects are minimized via your consultant, called as process of therapeutic drug monitoring, TDM. So TDM is essential to understand by your physician or your consultant or your pharmacist that the therapy is going to take place in less time with a good accurate dose with least of the side effects. So drug dose and its response relationship are always based on various multiple factors, which is why you have to be very considerate when you are taking the medicines, and you should know that what are the factors which are affecting them. The first one is body size. I'm going to take the similar medicine, that is paracetamol, and I'm going to take the similar dosage, that is 500 milligrams, but this time I'm going to go and give it to two people. One is a thin man and one is a fat man. Excuse the drawing. Now this similar dose is given to both of them, but we would eventually find out that the extent of severity of the effect and intensity effect is going to be shown more on a thinner man. This all depends on parameters which are actually found out via Pharma-Assist. BSA is a more appropriate method, which is called as body surface area, where we analyze that which and what quantity is to be prescribed of that particular drug. Second is the age of patients. We all know that every time we don't take the same dose of drugs by the adults, by the infants, by the young ones, or by the elderly patients, right? We can see over here that I have drawn an old person, and that old person would be not requiring the same mg of drugs apparently, yes, and obviously a neonate or a young one is going to need a little and a different dosage of the similar medicine to treat a fever, for example. 500 mg TID is a different case, 120 mg QID 4 times a day from the previous video, right? Babies, for instance, babies do not take the medicines that easily because their body water quantity is more than the quantity of proteins in their bodies, and because the protein is less in their body, that is why the drug is unable to bind itself to any protein, and because drug is unbound in the serum, it might cause any toxic effect. So you have to be very considerate that why the babies don't take the medicines, right? Also the baby's development of liver and kidney is not that much authorized to have the clearance and everything, so that is why we don't prefer the babies to take the wholesale medicines directly via mouth. Now the third factor which affects the drug dose and its response relationship is polypharmacy, which is a very common case. What is polypharmacy? Polypharmacy is taking every kind of medicine. For example, you are suffering from blood pressure, and you are suffering from fever, and you are suffering from an arthritis, so you are taking every medicine. So these drugs might counter effect each effect. This is called drug-drug interaction. So you have to be very considerate. You should ask your physician that if there is any response of synergetic effect of both of the drugs together or not, or are they going to cancel the effect of each other or not. Fourth factor is gender. Very, very essential tool to be understood. If a male is taking a medicine or if a female is taking medicine. The factors are not very much clear over here, but still, for example, antihistamines are going to cause cardiovascular effect and cardiotoxic effect more in a woman as compared to any man, or antacids cause more of a severity and solution in a female as compared to a male. So again, these all things vary from gender to gender, sometimes because of hormonal balances as well. Fifth factor is pregnancy, because apparently we know that during the pregnancy there are multiple physiological changes going on. First, the kidney is also being affected. The second place, liver is also being affected. Third, GIT, the gastrointestinal tract, your stomach system. So because all of the medicines cannot be easily taken in the pregnancy, because all of the medicines cross the placenta and they might affect the fetus of a mother. So we are usually very considerate while taking the medicines during the pregnancy. Sixth factor is drug forms. There are different multiple forms of drug. Sometimes we see that the drugs are in injection forms. These are called intravenous, sometimes subcutaneous, directly intravenously injected, right, through the bloodstream into your veins. Sometimes we see that there are medicines which are taken through mouth and just galloped in, swallowed in. Sometimes we see that the medicines are put into the water and they are dissolving there. So then different forms have different effects in your body. You have to ask your person and physician to ask about it. Seventh is the route of administration. The similar drug forms are passing through different forms. For example, injection is going to show more of an effect if directly injected into the bloodstream. Absorption is the major concern over here while considering the route of administration, because we want the most of the therapeutic effect. Eighth factor is drug-food interaction, which we usually ignore. For example, grapefruit. Grapefruit is very different fruit which actually inhibits the growth of those enzymes which helps the metabolism in your liver. So while taking any medicine, make sure that you take the required food which helps in the digestion, distribution and absorption of that particular medicine. Also now, the ninth and the last factor over here is the kidney and liver dysfunctioning. Your kidneys and livers should be good in health. They should effectively work, because renal function, renal clearance, kidney function is to clear the drugs, extracts out of the body, while the liver functions in the metabolism, in the actual distribution of a drug and spreading it everywhere where required. So I hope that these factors are kept in your mind so that you have a clear understanding that why the drugs are affecting you or not. Thanks for your watching time. Thanks for the precious information you always put in. While asking any queries, you can ask me out. I'll always stretch a smile on your face. And obviously, I would ask you out, do like my channel, do follow me up, do subscribe me at my channel, because it's very necessary to be aware of what your physician, what your pharmacist